Hello and welcome to Cycle Tracking for Pregnancy Achievement. I am your host, Brandy Oswald, the founder of Sauvage Wellness. I am a certified fertility awareness instructor and cycle educator who helps women learn how to track their cycles to achieve pregnancy naturally when they're ready. We also use cycle tracking to identify and uncover potential hormonal imbalances that could be hindering fertility and pregnancy achievement. So today we're going to take a look at how to get started with cycle tracking as a tool for you to optimize your fertility and to increase your chances of achieving pregnancy naturally. To get started, I'm going to share my screen with you so you can follow along with the slides. So just give me a moment to cue that up and we will kick things off. All right, cycle tracking for pregnancy achievement. What we're going to cover in today's mini class is what is cycle tracking exactly. We'll also talk about how we use it to get pregnant, as well as things like using cycle tracking as natural birth control and to have better periods and uncover those hormonal imbalances that I was talking about. We'll look at tracking cervical fluid, temperature, and cervix, as well as opening and closing your fertile window. First things first, what is cycle tracking? So cycle tracking is the practice of tracking specific body symptoms like cervical fluid, basal body temperature, and cervix changes to know exactly where you are in your menstrual cycle. Cycle tracking is not the same as period tracking. Period tracking is just noting the first day of your period and then counting down 28 days and taking a prediction or guess at when your next period will happen, and then estimating that somewhere in the middle is where ovulation happens. Period tracking is a whole lot of guessing and estimating. Cycle tracking is certainty. It's knowing what's going on in your body in real time. The sympto-thermal method is the method of cycle tracking that I use and teach here at Sauvage Wellness. The sympto-thermal method is a specialized form of cycle tracking that is one of the many forms of fertility awareness methods. Now, fertility awareness methods are methods of birth control and pregnancy support that are based on observation of fertility signs. And there's not just one fertility awareness method. There's not just one way of tracking your cycle. There are many different ways of doing it. And the one that I use and teach is the sympto-thermal method. So with the sympto-thermal method, we can do a lot of things and get access to a lot of information. The first of which is knowing which phase of the cycle that you're in. With the sympto-thermal method, we can also know if and when you ovulated in your cycle. We can spot hormonal imbalance. We can identify your fertile window. And we can optimize libido, energy, and emotional needs throughout the month. So what exactly is the fertile window? This is a term I've used a few times now. So the fertile window is the window of time each cycle that you can get pregnant. And the fertile window is approximately 6 days long for everyone, and it does not change. This is because sperm can live for up to 5 days in optimal cervical fluid, and the egg can live for up to 24 hours after ovulation. 5 days sperm life, 24 hours egg life equals 6 days for pregnancy and conception. So what do we keep track of when we're using the sympto-thermal method? We keep track of cervical fluid, basal body temperature, cervix changes, and body symptoms. And those last two, cervix and body symptoms, are optional tracking tools. So how do we use cycle tracking to achieve pregnancy? Here's the big one, right? So we can use cycle tracking to open our fertile window using cervical fluid. We can identify peak fertile cervical fluid days because different types of cervical fluid are better equipped for sperm mobility and transportation, aka helping sperm and egg meet conception. We can also use cycle tracking to read cervical fluid and temperature shifts to close our fertile window to know when we're outside of the fertile phase. And we can isolate pregnancy achievement attempts to within the fertile window, rather than trying too early or too late, too far away from ovulation. Cycle tracking can also be used to identify potential hormonal imbalances that could hinder pregnancy achievement, like excess estrogen, low progesterone, and luteal phase deficiency, which we'll dive into here in a moment. So how exactly do we use cycle tracking to spot some of these imbalances? It's very cool, very clear. So cervical fluid can tell us if estrogen is too high or too low, because the production of cervical fluid is triggered by the presence of estrogen. Temperature can tell us if progesterone is low or if estrogen is high. This is because temperature changes often happen in response to increasing levels of progesterone. And we can spot delayed ovulation while charting and cycle tracking, so that we're not trying on day 14 if in our own cycle we don't ovulate until later, day 20, or even later than that. And we can identify short luteal phase, which can signify a progesterone and estrogen imbalance and hinder fertility chances, pregnancy achievement. So this estrogen progesterone imbalance that I'm talking about can lead to a few things. Some of them are very common, like heavy periods, long periods, longer than 5 days, things like PMS, breast tenderness, bloating, spotting before the period, and even implantation struggles. And implantation is a huge piece of the pregnancy achievement equation. It's not enough for sperm and egg to simply meet. We have to have enough time and enough progesterone for implantation to occur so that pregnancy actually takes hold. And therefore, estrogen progesterone imbalance can sometimes lead to fertility challenges. And we can spot this imbalance using cycle tracking, using the sympto-thermal method. So speaking of the specific tracking markers, let's dive in a little bit. What the heck is cervical fluid? So cervical fluid is produced by the cervix under the influence of estrogen. And cervical fluid is crucial for pregnancy achievement and is made in preparation for ovulation. This is because cervical fluid is what transports sperm to the egg. And cervical fluid allows sperm to live in our body before ovulation even happens, so that it's ready and waiting for when ovulation does take place. So cervical fluid allows us to neutralize the acidic environment that would be our vagina if we didn't have cervical fluid present. So cervical fluid is really impactful for sperm lifespan. It's what allows us to have that 5-day sperm lifespan. Without cervical fluid, sperm would die off quite quickly. And cervical fluid allows it to stay alive for up to 5 days so that it's ready and waiting when the egg is released during ovulation. So the presence of cervical fluid tells us when to open up our fertile window. It tells us that ovulation is about to happen. It's upcoming. And cervical fluid takes a very common transition. You may not see each and every one of these transitions in your cycle, but this is the general transition of cervical fluid throughout the menstrual cycle. One, you have your period, which is not cervical fluid. It is the lining of your uterus shedding. Then you might have a few dry days where you don't really notice much wetness or sensation at the vagina at all. And then it might transition to being wet and watery, literally like clear, watery liquid, like a gush almost coming out of the vaginal entrance. And then you might notice creamy and milky, almost like hand lotion. And then you might start to see cervical fluid become stretchy, a little bit cloudy, and you could pull it between your fingers an inch or so. And then from there, cervical fluid tends to transition into what we call egg white or slippery, which literally looks like raw egg whites. If you had cracked open an egg, just the egg white part of it, clear, slippery, slidey. You could stretch it really far between your fingers. And that is our peak cervical fluid. That is a type of fluid that is best for sperm transportation and mobility. And then from there, after we ovulate, we tend to return to a sticky, crumbly, or gummy type of cervical fluid under the presence of progesterone, which thickens that cervical fluid back up. And so it's on these creamy, stretchy, and egg white, slippery days that we really want to concentrate our pregnancy achievement attempts to really get close to that peak, that optimal cervical fluid. And this egg white, slippery peak fluid is the type of fluid that's made closest to ovulation. Alongside cervical fluid, we're also tracking basal body temperature. Basal body temperature is your temperature first thing in the morning after you have been sleeping and before you get out of bed. So it's suggested that we take our temperature after at least 3 hours of uninterrupted rest. So if you wake up early and you're having trouble falling back asleep, that's okay. Stay in bed, read your book, get 3 hours of uninterrupted rest, just restful time. And so we track our temperature because temperature tends to be low before ovulation and then rises slightly after we ovulate, and it stays high until our period begins. So why does this shift in temperature occur? Temperature shifts as a result of the hormone progesterone. As progesterone rises following ovulation, it causes a rise in temperature. Now, we only make progesterone after we ovulate as a result of ovulation. So if we're starting to see a rise in temperature, we know it's because progesterone is present. And if progesterone is present, we know it's because we've already ovulated. And then progesterone will stay high throughout the rest of our cycle and dips slightly, triggering the release of the uterine lining and that return to lower temps and the presence or the ushering in of our period. Now, if you are to achieve pregnancy, progesterone will stay high, temperatures will stay high, and an early form of pregnancy testing is to record 18 plus high temperatures after confirmed ovulation. So before you even take a pregnancy test, your temperatures might be able to tell you if you have achieved pregnancy. Little built-in pregnancy test, if you will. So it's important to note that temperature does not tell us the exact moment that ovulation has occurred. Rather, it informs us that ovulation has occurred after it has happened. It's also important to note that temperature does not tell us anything about impending ovulation. We really use it as a confirmation tool to confirm that ovulation has happened in our cycle. Now, the optional sign for tracking here is cervix position and texture. And it's important to talk about the cervix, especially in terms of pregnancy achievement, because the cervix becomes really important in the phase of pregnancy, right? The cervix is hugely important in the birthing process. And now the cervix is something that we can literally reach inside our bodies and feel on any given day. And the cervix changes under the influence of estrogen and actually gives us signs as to where we are in our cycle. So your cervix is located at the back of the vagina, right around here, and it feels a bit like an olive, right? It's a bit firm with a little opening on the front. And it is from this tiny opening that cervical fluid, period blood, and babies make their way into the vagina and out into the world. So what's the deal with the cervix? The cervix tend to be high, soft, and open around ovulation. So it's located further back in the vagina. It feels much softer, and the opening on it is more open than it usually would be, the closer we are to ovulation. And the further away from ovulation we are, the cervix tends to be lower, firmer, and more closed. So this tends to be what we feel, this low, firm, and closed. We feel that often just before our period begins, as well as maybe just after it wraps up, but really in that post-ovulatory phase. Now, estrogen softens the cervix, and the presence of progesterone tends to firm it up. So we can use cervix tracking as a confirmation tool for what we are seeing with cervical fluid and temperature. And the cervix can be easily reached with manually using clean fingers. So how do we use all this information to confirm that you have ovulated in your cycle, that you are having ovulatory cycles, and to understand where ovulation is happening for you? So once you learn the 4 specific rules of the sympto-thermal method, you will be able to use cervical fluid and temperature to confirm ovulation and determine the opening and closing of your fertile window. So the sympto-thermal method, especially the double check method, which is more specifically what I teach, has 4 rules. And so once you learn how to use those rules, the dry days rules, the shorter cycle rule, the peak +3 rule, and the 3/6 rule, which I teach in all of my work over at Sauvage Wellness, you'll be able to use the information from cervical fluid and temperature to not only open and close your fertile window, but to confirm ovulation and to understand better where it's happening in your cycle. So how do we use cycle tracking for pregnancy achievement? It's really important to recognize that pregnancy achievement is not just about finding your fertile window. That's a common misconception. There's a lot more that goes into achieving pregnancy than just knowing when you're fertile during your cycle. For instance, you probably don't ovulate right on day 14. That's a myth. Some of us ovulate in and around that day within a several day window of day 14. But for folks with longer cycles, if your cycle is 30, 35, 40 days long in between your periods, you're probably not ovulating anywhere near day 14, probably in fact much later. And cycle tracking can help you find that. We also need to know how to optimize our peak cervical fluid. If we're having pregnancy attempts and the presence of cervical fluid isn't there, right? So we're not having creamy, stretchy, or egg white, slippery cervical fluid, it will be very hard for sperm to live long enough to fertilize the egg. So if you're having cycles in which there's not a lot of peak cervical fluid, we want to work on boosting the hormones needed, right, to make optimal cervical fluid. And we also don't want to wait until temperature rises to start trying. That is simply too late. Common misconception that we see in movies and TV shows all the time is a woman takes her temperature and goes, my temperature just rose, I'm ovulating, we have to start trying. That's not how temperature works. Once your temperature has risen, you have already ovulated, and the egg only lives for 12 to 24 hours for conception to occur. So by the time your thermometer is triggering a rise in temperature, it's likely too late for conception in that cycle. Temperature confirms that we've ovulated and that all the attempts leading up to that temperature rise are viable for conception. It's also important to recognize that there has to be 10 to 16 days between ovulation and the potential start of your period for pregnancy to take place. If there has not habitually been in your cycle 10 to 16 days between ovulation and your period, there may not be enough time for implantation to occur, which means sperm and egg could be meeting month after month after month. And if there's not enough time for that fertilized egg to implant into your uterine lining before it lets go and turns into your period, then that fertilized egg is unable to become a pregnancy, right? It can get flushed out or reabsorbed and we would have our period. So we have to have enough time in that luteal phase in order to achieve implantation and therefore achieve pregnancy. And so when the luteal phase is shorter than 10 days, we're looking at luteal phase deficiency. And we can see this right on your chart, tracking cervical fluid and temperature. So I want to share with you an opportunity for us to work together if you're interested in learning how to very specifically track your cycle using the sympto-thermal method to optimize your fertility, identify your fertile window, and to help you achieve pregnancy naturally when you're ready. So a great place for this is my Sauvage Sisterhood membership community. This is a virtual community for wild women. And as a Sauvage Sisterhood member, you get access to a ton of valuable education, support, resources, and even one-on-one access to me. So in the membership, you get access to my Cycle Tracking 101 intensive workshop, which will break down everything you need to know to start tracking your cycle: cervical fluid, basal body temperature, cervix, body symptoms, all of it, and help you really hone in on your fertile window and your cervical fluid transitions. You will also get access to my Optimizing Your Fertility Masterclass, which is a deep dive training into how to really optimize your fertility, not only with cycle tracking, but with things like food, diet, movement, herbal support, lifestyle support, all the many things that go into impacting our fertility. In the membership, you very uniquely get one-on-one access to me. So I have office hour calls every week that are one-on-one, and you can chat with me to review your charts, to review your cycle tracking information, and to make sure you're really optimizing your cycle to achieve pregnancy naturally. And lastly, you get access to monthly masterclasses on cycle tracking and fertility to help support you all throughout this process. So if you're interested in learning more about the Sauvage Sisterhood membership, you can click here on the slides that will be provided for you, or simply head to sauvagewellness.com/membership and get all the details. Thank you so much for joining me for this incredible cycle tracking for pregnancy achievement training. It has been such a pleasure to be here with you, teaching you all about my favorite topic, cycle tracking. If you need anything or you want to stay in touch, you can follow me on Instagram at Sauvage Wellness and send me DMs, send me your comments. I'm happy to engage in conversation and to share any information that I can to support you on your pregnancy achievement journey.